Son, what is diabetes? Is it a contagious disease?
Who said that, Mom? The disease is considered to be a non-communicable disease. This means that we do not get the disease if we eat or stay with a diabetic patient. Diabetes is one of the major non-communicable diseases that is currently threatening humans.
Oh, I heard at the society today that Adam also has diabetes. What exactly is going on here, son?
Not only Adam, this disease can affect everyone. This causes the amount of sugar or glucose in our blood to be higher than normal. That's what we call diabetes.
Does this disease only develop if we eat sugar?
No, Mom. Not only sugar but also carbohydrates are also converted into glucose. This glucose is finally absorbed into our bloodstream.
So is it better to have more sugar than you need in your blood?
No. Too much glucose is bad for our body. So our body produces a hormone called insulin to reduce the amount of glucose that rises. It reduces the amount of glucose in our blood and maintains a normal level.
So is there no cure for this disease?
According to the Western medicine, there is no cure for diabetes. The disease can be controlled. For that, controlling diet, doing exercise, getting the right medications, and maintaining mental fitness is important.
What else is available about this disease? Can small children also get this disease?
Yes, Mom. There are two major types of diabetes. They are type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 diabetes mellitus, also known as insulin-dependent diabetes. This often occurs in childhood or adolescence. Moreover, type 2 diabetes mellitus, also known as insulin-independent diabetes. This pattern is more common among adults.
Please, son, let me know the difference between the two.
Insulin is produced by beta cells in the pancreas. In type 1 diabetes mellitus, autoantibodies produced by our body destroy the cells, resulting in a small amount of insulin production or no insulin production at all. At that time we say that is type 1 diabetes mellitus.
So is there a cure for this?
So all you have to do is give insulin to the body from outside. Insulin is a protein, so you can't drink or eat it. It is given to our body by injection. This is done according to the doctor's instructions.
Then what happens in type 2 diabetes mellitus?
In type 2 diabetes mellitus, the patient can produce insulin, as there is no any damage to the pancreas. However, the patient's cell's response to the insulin hormone is reduced or lost. Then these patients need to be given an exogenous drug to that activate the insulin.
Son, what are the symptoms of diabetes?
Usually a patient has a few symptoms. These include high thirst, dry lips, frequent urination, fatigue, and thinning of the body in some patients.
Is there a way to diagnose this disease?
There are a number of medical tests that can be done to diagnose diabetes. These tests are helpful to determine if you have the disease or are at risk for developing it in the future.
So what are those tests?
There are several laboratory tests. I will mention a few of them. RBS or random blood sugar, FBS or fasting blood sugar, HbA1c, Ppbs or postprandial blood sugar series, UFR or urine full report.
Can you please explain them?
RBS means that we can take a blood samples at any time to see how much sugar is in his or her blood at that time. You do not have to fast for this.
Then what is FBS?
FBS is checking the glucose level after fasting for some time. This should be done after fasting for 8 to 10 hours. In this case we can drink water. But we can't drink calories like tea, lime juice and orange juice.
Please explain other tests also. It's interesting to know them.
There is another test called HbA1c. This usually costs more than the FBS test. But we have a lot to gain from this. No need of fasting for this test, and it gives a clue about the sugar control within 3 months.
Thank you, son. What is Ppbs test?
In Ppbs test, a blood sample is taken 2 hours after the meal to see how high the blood glucose level is. I will explain other tests later, Mom. Now I want to leave.
Okay, we'll discuss later.
Mom. If you want to see if you have diabetes, it's better to have a checkup. It's better doing these tests at least once in every 6 months and seeking medical advice.
Surely I want to have a checkup. Thank you.